Welcome to Hardemil Dental Clinic. My name is Christian Mill, and with this small video we show you how we repair small bone defects with bone grafting procedures.
You can see here the lower jaw right, and in the lower jaw right, indicated by the yellow arrow, the fifth tooth on that side, which needs to be taken out because of an apical inflammation, here again indicated by a yellow arrow. The patient has as well two more inflammations, as you can see in a second, shown by two small blue arrows, which we have dealt with in the same operative appointment. But in this video I'm going to show you how we dealt with that inflammation of that tooth. So when you take out the tooth, of course you have a hole, and in this case you can see indicated by the small yellow arrow and by the large or longer yellow arrow where the tooth has been. So we place an implant directly, and of course ideally could see where the implant was going, because the inflammation and the inflammatory process ate away the bone. And of course, if you take out the tooth has a different anatomy from a round implant. It is more an oval shape or rectangular shape, depending on which tooth you take out. So of course, you have to close both holes with any kind of grafting material. It can be the bone which you have harvested from the operation site, or it can be artificial bone deriving from bovine origin or porcine origin, and you have to fill these gaps or these inflammatory deficiencies, which we've done here. And then you just close up the soft tissue again. And what you can see here, we've placed the implant, put an impression coping on top of the implant so that the technician knows the position of the implant, and produce the temporary immediately, so that the patient can go home with the tooth on the same day he had the operation. So tooth out, implant in, filling again the defects with bone grafting material, and then take an impression, send it to the lab, and 1 hour later the patient can go home with the temporary. You can see here the temporary indicated by the yellow arrow after 4-month wearing. And you can see the soft tissue here absolutely perfect. You can nearly not distinguish which one is a tooth and which one is an implant. So this is the situation before we take the impression. You can see the implant healed perfectly into the bone, and the soft tissue around is just complete without any inflammation and looks nice and healthy. So in this situation, we can take the impression, take the color, send it to the technician, and he can produce the final crown. You can see the implant body itself is not a full titanium body. It's empty or hollow inside, so you can screw something in. And you can see in here the final crown indicated again by the small yellow arrow. And this crown was screwed in. You can see the perfect shape and health of the soft tissues. So we placed the tooth, I think, very thoroughly and very nicely with an implant supported crown. Thank you very much for your kind attention.